So let's quickly look at possible treatments for hyperkalemia, right? And before you could actually know the treatment for hyperkalemia, at least you should know what hyperkalemia is, all right? So in summary, hyperkalemia is basically what elevated levels of potassium more than what is needed, all right? So you're having too much potassium more than what is needed in the body, okay? So there are some possible treatments for this condition, and actually want to look at it. So before we look at the treatments, let's look at the adverse effect, okay? So you have things like the person will be experiencing heart palpitations, there will be muscle weakness or numbness, there will be nausea and vomiting, right? There will be chest pain, there will be diarrhea, there will be arrhythmia, there will be abdominal pain, right? All these could be symptoms of what? Hyperkalemia. So let's look at the treatment. So the treatment is basically you are aiming at what? Reducing potassium levels in the body, all right? So the first thing, okay, if you are taking too much potassium in diet, then you should decrease the intake, right? So basically, when you decrease the intake, it will decrease absorption, definitely. Then also you can use calcium to antagonize potassium-induced, okay? Potassium-induced decrease in membrane excitability. Basically, you can use calcium to antagonize it, okay? Then you can also use insulin and glucose, right? You can use beta-2 agonists like what? Albuterol, okay? You can also increase potassium excretion, right? Like you go on to what? Hemodialysis and peritoneal dialysis. So this dialysis could be important mostly in patients that have problems with renal excretion of potassium, okay? So you opt in for dialysis just to clean up the blood so that it won't result into any adverse problems, okay? So these are the possible treatments for what? Hyperkalemia. All right, so that's it.